How are you managing conflict in your organization? An hour from now, you're going to know three things that will help you become a better leader, lead a more impactful organization, and make a difference in the health of the patient population that you touch. Now, those three things that you will appreciate here pretty soon are going to be: one, the negative impact of conflicts in your organization and other healthcare settings, and what the impact is, uh, even for safety. Another thing you'll appreciate is how conflict resolution is much more than addressing individual grievances. It's a proactive mindset that will lead you to baking in conflict resolution to your organization's strategy. Thirdly, you will appreciate how to replace a culture of avoidance with a culture of conflict engagement. So, I'm Jim Trouson, the mayor of our little virtual town of Medvale. Welcome to this month's Medvale Lyceum, where we invite our citizens and our friends together to learn and talk about a topic that will help them to deliver better health to their communities. We stole this idea shamelessly from another town. Ancient Athens invited their citizens to free lectures. Presenters like Aristotle would share ideas worth consideration. They call these lyceums. We do the same. Today's topic is from avoidance to competence, engaging conflict for better care. Our presenter is Jeff Stuart. He's a member of our Medvale community and a member of our Physician Executives Club. Jeff was introduced to us by our own Pam Hall. He's an anesthesiologist, and Jeff, you're still practicing. He was, in a prior life, a hospital executive, once as the medical director of clinical transformation for his hospital, later as the CMO. He's also been the managing director of an ambulatory surgery center. Jeff is a Stanford grad with a Wharton MBA. He lives and works in an important healthcare hub, Nashville, Tennessee. And Jeff is going to lead a discussion on this topic at our summer camp in June in Sun Valley. Uh, Jeff, you've got two partners here,
I do.
uh, and you can let me just explain a little bit about uh, who we've got here. Nicole is a partner in so many ways, to include his wife, and so we're getting to know her well as we're involved in projects in their company. And then, Paul, you want to wave? Uh, uh, Glad you're here. I haven't really met you before, Paul, but you could qualify as well to be a Medvalista. Paul is a cardiologist. He has been a hospital CMO. He's been on the hospital board, president of a large medical group. So, Jeff, I'm going to
Sure.
quit talking so much, and
Yeah.
so that you can. Anything else you want to say about Nicole and Paul?
Just real briefly, although I could talk about both of them forever. But yeah, Paul and I, the story of resolved conflict, kind of how we started, is goes back with Paul and I lived together during residency, and I can kind of explain our connection and Nicole's to the company as I kind of give just the brief history of how we got started on this. But as Jim said, I'm a practicing anesthesiologist. Many years as a physician leader, physician executive, various roles. Always was interested in communication and those challenges. But really, all this kind of came to a head for obviously many of us, if not all of us here, during the pandemic. And Paul and I, as I said, who had lived together as residents way back in the day, both found ourselves as pretty new CMOs of community hospital systems. And we started having weekly commiserating slash brainstorming meetings, I guess, about things. And as we worked through our discussions, really kind of coalesced around communication, the importance of communication, the challenges of it, the ever present nature of conflict in hospitals, especially during the pandemic. And we kind of coalesced around this as something we both seem to have a skill set that matched, as well as a deep interest in. And beyond that, as we were discussing all this, Paul had undertaken formal mediation training. Nicole is a attorney by background, a family mediator and coach. So I always had this mindset from her, and that's where her legal and mediation skill set comes in to support our work. And yeah, that all kind of tied in with both Paul and my discussions, and then my realization also as I was working through the pandemic myself with my CEOs, things we had done very intentionally about communicating with the medical staff that I saw, paid huge dividends over the course of our management of the pandemic. So all of this kind of coalesced to kind of kick us off on this interest and feeling like we really wanted to use our skills and our perspective to make a difference because we really felt like a consistent strategic approach to conflict, from organization to organization was not present or not well understood. And so that's when Resolve Conflict was born, I think 2 or 3 years ago now, with the mission of helping healthcare organizations, physician groups, and physicians engage conflict much more quickly than it has been and productively, and help the organizations build trust and alignment, all working towards what's all of our common goals is improved patient care.
Mhm.
And we came across when we were researching and kind of digging into this, which we've done really for the last 5 years, kind of a seminal paper in our thinking by Deborah Girardi and Charity Scott, which was published in 2011 in a Joint Commission journal. And why that's relevant and important is because the Joint Commission, as some of you may know, has a lot of standards around conflict, including a leadership standard, which delineates that the leadership groups of the hospital, the governing body, i.e., the board, the administration, and the medical staff, work together to develop conflict processes around conflicts between leadership groups to the benefit of patient care. So even in the Joint Commission standard, this was kind of this what we've learned to call a strategic approach, and kind of built off the work of Deborah Girardi, in that way. It's kind of codified in Joint Commission standards. And as
Mhm.
we dug into this more, we realized that, and we'd seen it for 30 years in our practices, that the reaction, and this is, I'm generalizing because obviously I don't want to disrespect any organizations that are represented here that manage conflict in a much better way than we see it in most places, or certainly in our own organizations. But it was very, very disjointed, disconnected, and you know stable in some ways on the bottom tactically, as far as there is some work on skill building and processes that build communication, but there was not a systemic approach to conflict. And what I mean by that, and developing a more strategic approach, is having thinking about conflict and approaching it in a way which is explicitly communicated throughout the organization, that it is connected and driven by the organization's mission, which in most of our cases involves high quality and safer patient care, as well as creating a good work environment for all of us within our organization.
Yeah,
Again,
well, and
yeah,
Jeff,
sorry.
something I've learned from you is my view of conflicts and conflict resolution is more on a one person to one person basis.
Hmm.
Uh, and I know that's not the case anymore. That you really are looking at it as a leadership team, maybe the C-suite versus the medical staff. So bigger bodies instead of just uh, you know working with a misbehaving surgeon to not upset people in the OR. So that's the new frontier, I guess, isn't it? That you
Yeah,
guys
well,
are
it is,
lassoing.
yeah. I mean, it is, so that is part of kind of that, is having a strategic view of the whole thing, where it's the one-on-one conflicts are certainly important, but they're not, the way we deal with them in most cases now is they're sort of isolated incidents and regarded as problems to be checked off and kind of move on to the next thing. When you get the leadership group involved, and really the primary reason why I bring that up, and yes, it is exactly what you're saying, a different kind of segment of conflict. It really how the leadership groups manage conflict and how they delineate policy, how they communicate their attitudes throughout the organization really sets the stage for how everybody addresses conflict within the entire organization. You still
Mhm.
need these tactics of being able to deal with one-on-one, whether it's a nurse and a physician, whether it's two nurses, two physicians, a physician administrator, et cetera. But it has to be part of a larger process. And we really feel strongly about that because there's this real conflict again being dealt with historically has been really kind of tactical, I would say. There are conflict skills
Yeah.
you can make it through a given discussion, but what that really leaves out is this conflict in healthcare where Paul and I are both trained mediators, and the reality is that mediation or facilitation in healthcare organizations is different than more transactional businesses because we are providing care together day to day. And if we have a conflict on Wednesday and we are not able to work through it or address it for 2 months, we're still working together through all of this. And it's kind of festering and growing and we haven't dealt with it. So there's this whole relational aspect in healthcare because we are working as teams inevitably. We are all working together day to day to a higher cause. And we all have our own reasons for why we're involved with healthcare, and different groups in healthcare may have different motivations. And whether it be more kind of looking over the financial kind of security of the organization that administrators are charged with, the immediate being a patient advocate in every respect that a nurse is kind of tasked with, and then a physician really trying to solve medical problems as well as the other around. And with good intention, people have very different approaches maybe to a different give situation. And what is allowed to happen in healthcare too often is because they have different approaches, we end up with what is referred to as task conflict over something that's happening. And it
Mhm.
it it festers and becomes relational conflict. And when that happens, communication breaks down. Everybody in healthcare is exceedingly conflict avoidant. The trickle down effect is poor communication, people feeling like they are miserable at work. Ultimately, medical errors are made. And that's really the human cost to patients and those involved. And then there's the financial cost from this, which is
Yeah.
from retention, the fact that team operational success is compromised, and then of course, as we all know, the if things hit the hierarchical or rights-based path of conflict resolution immediately, you're immediately on a road that's going to take you through a high cost of escalating legal proceedings.
Yeah.
So,
Well, Jeff, I suppose there's some hospitals, I know you work with more than just hospitals,
mhm,
that do this better than others.
right.
Is that right?
Well, we haven't.
It's a learned skill?
We know of hospitals that do it better than other. We haven't really worked with those so much, but I think when we talk about again, this is just because I'm so passionate about it. Having a strategic approach, um, there are characteristics that kind of delineate what this is, and beyond aligning it with the mission explicitly, as I said, as opposed to viewing conflict. And this is from the leadership buy-in, as opposed to viewing it as a problem that just needs to be solved. You need to develop awareness throughout the organization that okay, we're going to have conflicts, it's inevitable. We're going to develop processes that everybody knows what they are and how it's going to be managed. These are going to be processes, again, this is another strategic aspect, that are in a tiered progressive way, so you can maintain this relational aspect of addressing conflict through more informal processes initially, whether it be coaching, informal facilitation, side conversations between people that are kind of facilitated, all the way through the more formal mechanisms. And I just want to add an interesting side story on this, how I feel healthcare is different in this way that we've kind of another kind of interesting fact is not till late 80s was the word conflict even used in medical literature because we were so conflict avoidant apparently. But when I did my mediation training, there were director level executives from various tech firms doing the training because these organizations have uh, people with some conflict expertise and skills, which is clearly needed for leaders. I mean, that is a key piece of a strategic approach. But these people were embedded in this training. I'm sorry, part of this training so they can be embedded with their organization. So their skills were baked into their day to day work. Do you know how many people from healthcare were there? I was the only one. So it kind of blew my mind that that was the case, and that historically it's been so largely ignored. And it's kind of amazing me given the need we see for it every day.
Yeah. Well, don't you think that's our go-to style is conflict avoidance? Uh, and that's part of the rub between physicians and healthcare administrators,
Yes,
uh, because physicians, for the most part, will avoid conflict. So, uh,
absolutely. And not only that, I don't have it at the ready here, but there's a paper from maybe 10 years ago which comparing the general public to people working in a hospital. I think this is situationally based as far as, what your perspective is within the hospital, or within your workplace. But it was a significantly higher degree of avoidant behavior among healthcare professionals and a much lower degree of collaborative behavior. There's a whole thing called the Thomas Kilmann kind of assessment for your conflict style. The sort of the maybe the worst possible end of it is avoidance. Although I know we're not going to get into this now, but happy to in another talk. It's a whole talk in of itself. And the most powerful is collaborative. And what a collaborative approach to conflict is one where there's trust on both sides, where people can speak freely without everybody being offended, that everybody's feelings get out. Exactly. And what this does is it unleashes a whole opportunity of seeing the whole idea, I'm sorry, of seeing conflict as an opportunity. In our work, conflict is it's an unavoidable risk to quality, safety, and human existence when it's unmanaged or avoided, as you're saying. But it's also, and this is where Paul and I are very excited about this. If anybody can be excited about conflict, which we are, it's one of the most underused opportunities for learning and innovation. And if leaders are deliberate in how they approach conflict attitudinally and process wise, and processes may be different in different hospitals or different organizations, it's a huge opportunity. And I mean, Jim, you and I talked about the whole Patrick Lencioni pyramid of dysfunctions of a team, and I know some of you may be, quite familiar with that, and how, the lack of
well,
trust. Yeah,
in fact, could we flash that up
yeah, it's very cool.
while you're talking?
Sure.
Yeah, go ahead.
And so basically, it's a really interesting book that I'm thinking many of you read. It's a very quick read. I really enjoyed it as I just, I think I read it earlier, maybe when I was in business school or just first taking a managerial role. But yeah, it shows like I wouldn't have think reflexively that like the base of a pyramid of I really view that I'm looking at the right side of it, so of function as opposed to dysfunction is the ability to resolve conflict. I mean, beyond trust, if you can't speak candidly and resolve conflict. There's other, obviously, people have had exposure to this idea with radical candor and things like that. But think for example, if you have a doctor and a nurse conflicted over an issue and that immediately goes to the rights based or hierarchical based of dealing with it, whether there's either a hearing and somebody comes down with a solution or just by the hierarchy of the situation, a decision is made. How much more powerful is it if you have somebody either internally or externally trained to manage a conversation between those two individuals to understand what's bugging the nurse about what the physician's doing, maybe and I'm simplifying, what's bugging the physician about what the nurse is doing. And that's where the opportunity for learning and growth comes in. And again, that's what makes it strategic because approaching it in that manner allows you to learn from it and proactively come up with solutions to patient safety issues that may not have arisen yet, but they're coming based on what you hear. So I find this pyramid and thinking about conflict as a part of it very powerful myself, and really kind of I think validates a lot of what we're talking about.
Well, another aha for me was that some of the reading that you and Nicole have sent over is the interest that the Joint Commission has about this.
Yep.
Uh, And I wrote down what they intend to do: manage conflict between leadership groups to protect quality and safety of care. That's
Right.
a rule that
No,
they're
it is.
holding hospitals to. So they must think it's a pretty big deal.
Right, and beyond that, I mean, I may be messing this up, but there's, like, dozens of standards around conflict, not just the leadership standard. The point of it, going back to your initial comment, is not too much to say that, that's just where you focus on conflict, but that's where you first need to focus on conflict. There's a lot of, standards built into conflict and communication throughout the organization and various pieces of the organization. And that is another thing, I'd just like to touch on, because there are many places manage conflict reasonably within the various silos of a hospital. The problem with that is, without a systemic approach that's connected, and it may be similar skill sets that there already exist, but there's no high level connection to these processes, things are going to fail, like siloed things do, in general. An experience, excuse me, an example from some recent work, I've been doing with, a physician that was having some issues, and coaching them. And this will illustrate, I feel, the disconnect. Is this physician had gone through a whole through conflict in their clinic, a whole process involving administration, HR. I was asked to see if I could help them, and in coaching, help them kind of come to awareness themselves and how they can approach things better, and more productively for themselves and for the organization. And I was making progress with this physician, although sometimes when things are mandated, as you all know, and anybody that's dealt with, physicians that have mandated behavior, and I'm looking at Mernal now because I know he has and does do this. They're not so excited to do it. So there's trust building involved, obviously, which is part of coaching and part of conflict resolution. But what happened in the course of this, I was in the process of building trust, making some progress, and I don't know if this individual hadn't checked in with HR or whatever in the proper time, but in the midst of me making progress, he got this nasty gram email from HR saying this, and this that he wasn't doing, which was so counterproductive to the work I was doing, which was going to benefit, I am still doing. So we've regrouped, with this physician and his clinic. So it's definitely challenging, and, I think that if you really even think about it, a lot of organizations, or in organizations, one that I came from, I can give as an example, even though I am very proud of how we managed communication, as I said, proactively in the pandemic. And I think because we were intentional about doing that, which is also strategic, we had a lot of success. But when I was reading through the bylaws, because I was reading through the medical staff bylaws, as far as if there's any, discussion of tiered, approaches to conflict resolution or discipline, or if it's more just kind of hierarchical or punitive. And, there's open-ended language, and even the AMA, quote unquote, recommended bylaws does have more open-ended language saying that we should have some of these alternative collaborative approaches to conflict there. And then I looked in the hospital bylaws, and this may seem silly, but when in the hospital bylaws, where there's like one paragraph that basically says if there's any conflict between the governing body bylaws and the medical staff bylaws, the governing body bylaws supersede the medical staff bylaws. So even though everybody got along well at our hospital, if push comes to shove, there's nothing there to, lean on as far as forethought on how you would manage conflict. And it's really, there's some really key pieces of what I believe a strategic approach to conflict. I've touched on some of them, but just, philosophically being proactive about it, not reactive to it, and really viewing it in a relational, collaborative way, as I discussed, and dealing with it in real time. I mean, how many of us, any physicians on here, have been involved in physician leadership or otherwise? And Tom, I'm sure too. So many conflicts are going on for a year without anybody knowing about them, and then you're toast. Like, you can't, I mean, you can do something, but it's not the same. You've lost the opportunity to maintain the relationship, and you've lost the opportunity, I'm sorry, to learn and grow as an organization. And that's really what we're trying to change.